that begin to form the neural networks in charge of processing information. Regions of the brain that contain the cell bodies are called the gray matter. The axons that form from the neural pathways are called the white matter because they're covered in myelin. Myelin helps in the insulation and order of neural transmission. And although cell differentiation is complete at birth, the growth of dendrites, axons, and synapses continue for years. Teratogens. Good prenatal care is essential during pregnancy. The child in development is mostly at risk for the majority of severe problems in the first 3 months. There are many factors in the risk and complications of pregnancy. The study of factors that play a role in birth defects is called teratology. Teratogens are environmental factors that can contribute to birth defects and include some maternal diseases, pollutants, and drugs and alcohol. Factors influencing prenatal risks include the timing of the exposure. There are several structures in the body that are at risk when a baby is forming. If a substance enters the body, the time of a structure's development, the damage to the structure can be grave. Also, the amount of exposure. Some substances aren't damaging unless the amounts reach a certain level. The number of teratogens. Fetuses or babies who are exposed to multiple types of them can have many more problems than those exposed just to one. And genetics. It plays a larger role depending on the teratogen itself. The genetic components of the mother also has a consequence. Some mothers cannot be affected or less affected by them. And then lastly, being male or female, males are more likely to have damage due to teratogens than females are due to the Y chromosome that have fewer genes than the X. Some teratogens include alcohol, tobacco, and sexually transmitted diseases. Alcohol is one of the most common. It is strongly recommended that women do not drink throughout their pregnancy. Alcohol consumption, especially in the second month, can lead to neurocognitive and behavioral difficulties. Tobacco is another common teratogen. When a pregnant woman smokes, the fetus is exposed to dangerous chemicals like nicotine, carbon monoxide, and tar. This lessens the amount of oxygen available to the fetus, which is very crucial during pregnancy. And tobacco use during pregnancy has been associated with low birth weight, premature delivery, stillbirth, and learning disabilities, and much more. And secondhand and thirdhand smoke also have negative impacts on infants. Lastly, sexually transmitted diseases. STIs such as gonorrhea and chlamydia can be passed to the fetus by an infected mother. Mothers should be tested as soon as possible to reduce their risk of infecting their fetus, and STDs can cause premature birth, birth defects, stillbirths, and much more. Maternal factors. So one of the maternal factors that I discussed were mothers over 35. Women over 35 are more likely to have an increased risks of fertility problems, high blood pressure, diabetes, miscarriages, premature birth, stillbirth, and a baby with a genetic disorder. Environmental teratogens can affect the quality of the eggs as women get older. A woman's reproductive system also ages, which can negatively affect the pregnancy. Some women over 35 opt for special prenatal screening tests to see if there are any health risks for their baby. Hypertension. 2 types of high blood pressure include gestational and chronic throughout pregnancy. Gestational hypertension only occurs during pregnancy, whereas chronic high blood pressure is when a woman has pre-existing hypertension, or also one who develops it during pregnancy and it continues after it. High blood pressure can cause premature birth and low birth weights. And the last maternal factor I discussed was stress. High levels of stress can cause complications during pregnancy. Stress-related hormones can affect a woman's immune system, resulting in infection and premature birth.
Okay, so now we're going to be talking about prenatal assessment. A number of assessments are recommended to women as part of their routine prenatal care to find conditions that may increase the risk of complications for the mother and fetus. Ultrasound is one of the main screening tests done in combination with blood tests. The ultrasound is a test in which sound waves are used to examine the fetus. Amniocentesis is a procedure in which a needle is used to withdraw a small amount of amniotic fluid and cells from the sac surrounding the fetus and later tested. Chorionic villus sampling is a procedure in which a small sample of cells is taken from the placenta and tested. Complications of pregnancy. Minor complications. There are multiple common side effects of pregnancy, although each pregnancy is different. Some may experience it in different degrees and severities. Some of the symptoms may be nausea, heartburn, gas, hemorrhoids, backache, leg cramps, insomnia, constipation, shortness of breath, or varicose veins. Major complications. There are several serious complications that can affect the mother and the child's health. Ectopic pregnancy happens once the zygote gets attached to the fallopian tube before reaching the uterus. Abdominal pain, vaginal bleeding, nausea, and fainting are symptoms of ectopic pregnancy. Preeclampsia is the most common complication of pregnancy. It is estimated to affect 5% to 10% of all pregnancies globally and accounts for 60% to 40 to 60% of maternal deaths in developing countries. Rates are lower in the United States, and preeclampsia affects about 3% to 5% of pregnant women. Maternal mortality. Based on the CDC, about 700 American women die from complications related to pregnancy each year, and this number is increasing. Bleeding, infections, and heart-related problems are the main causes. Possible contributing factors include the high cesarean section rate and obesity. Then, spontaneous abortion is experienced in an estimated 20 to 40% of undiagnosed pregnancies and another 10% of diagnosed pregnancies. Usually, the body aborts due to chromosomal abnormalities, and this normally happens before the 12th week of pregnancy. Cramping and bleeding result, and normal periods return after several months. Preparation of childbirth. Prepared childbirth combines the mother's physical condition to help provide, but also a healthy environment for the baby to develop, as well as helping individuals to prepare to accept their new roles as parents. One of the most common methods for preparing for childbirth is the Lamaze method. This method came from Russia and introduced to the United States in the 1950s by Ferdinand Lamaze. This method allows women to be in control in the process of delivery. It includes learning muscle relaxation, breathing through contractions, having a focal point during contractions, and having a support person. The majority of births occur in a hospital setting. However, 1% of women choose to deliver at home. Stages of birth for vaginal delivery. The first stage of labor starts with uterine contractions that may last initially 30 seconds and be spaced 15 to 20 minutes apart. Some women experience false labor or Braxton Hicks contractions, especially with the first child. The first stage of labor is typically the longest. The second stage includes the passage of the baby through the birth canal. This stage takes about 10 to 40 minutes. Contractions happen about every 2 to 3 minutes. The mother pushes and relaxes as directed by the medical staff. At this stage, an episiotomy or incision made in the tissue between the vaginal opening and anus can be performed. The third stage is mostly painless. During this stage, the placenta or afterbirth is delivered. This is typically within 20 minutes. And then we have induced birth, which is depending on the situation, a baby's arrival may need to be induced or delivered before the labor begins.
Assessing the neonate. At the moment of delivery, the child is given a score under the APGAR score. The APGAR score assesses the neonate in a score of 0 to 10. APGAR stands for appearance, pulse, grimace, activity, and lastly, respirations. Each category has a score from 0 to 2. If the neonate receives a score of 7 and up, he will be considered a normal, healthy delivery. But if the neonate receives a score under 7, he should immediately receive medical attention. The APGAR score should be taken post 1 minute of the delivery and then again at the 5-minute mark of the delivery. Appearance. The scoring appearance. A score of 0 will be considered if the neonate is completely blue in color. A score of 1 will be given if the neonate was pink in just his extremities. Around his body, but his extremities were blue. A score of 2 will be given if the neonate was fully pink. Pulse. A score of 0 will be given if the neonate has 0 pulse. A score of 1 will be given if the neonate has a pulse under 100. and a score of 2 will be given if the baby has a pulse over 100, which is normal for neonates and babies. Grimace. A score of 0 will be given if the neonate doesn't make any faces at all. A score of 1 will be given if the neonate has minor response to any stimulation. A score of 2 will be given if the neonate has a quick response to stimulation and is sneezing. Activity. A score of 0 will be given if the neonate has no muscle activity. A score of 1 would be given if the neonate flexes his arms and legs. And a score of 2 would be given if the neonate is very actively moving around. Respirations. A score of 0 will be given if the baby has absent respirations. A score of 1 will be given if the respirations are slow and irregular. A score of 2 will be given if the baby is vigorously crying. Problems of the newborn. Anoxia is a condition in which a newborn's brain is not receiving the proper amount of oxygen. Anoxia means no oxygen and stems from having hypoxia, which means low oxygen. This causes the baby to become cyanotic, which means turning blue, and can lead to further complications with the newborn. And in the worst case, can lead to the death of the newborn. Low birth weight. A newborn will be considered to have low weight if they are under 5 pounds and 8 ounces. A major problem for babies with low birth weight is that they will lack the fat that keeps them insulated to maintain a proper temperature. 67% of newborns with low birth weight are preterm, and this tracks infections. If a baby is born under 2 pounds, they can have an increased risk of developing cerebral palsy. A recent study has concluded that babies born with ADHD disorder, autism, depression, and OCD, this is due to the reduced fetal growth compromising brain development at times of high importance. Preterm. For a baby to qualify as a preterm baby, it must be born at or before 37 weeks of gestation. This makes the baby highly likely to be qualified as a low birth weight newborn. A baby being born preterm could have been caused by triggers that have disrupted the mother's gestation. Vaginal infections can lead the mother to release anti-inflammatory chemicals that can lead to her starting to have contractions. Outside factors like smoking can lead to a woman to have a preterm baby. A newborn that is born preterm can develop respiratory distress syndrome, which involves a newborn having a weak and irregular breathing pattern. Small for date infants. Infants that are born below the expected weight for a baby of their gestational periods are considered small for date. These newborns are on par are about 90% less than the other newborns at the same age. Small for date babies die at a rate 4 times higher than any other newborns. Postpartum maternal concerns. After giving birth, mothers face an emotional roller coasters. Baby blues is a term used for a moment of sadness after having given the birth. For 3 to 5 days after the birth, women feel a feeling of sadness. This sadness usually goes away after 10 days. According to the DSM-5, baby blues differs from postpartum depression. It can occur during your pregnancy to 4 weeks from your pregnancy to 4 weeks after your pregnancy. This can lead women to have problems bonding with their child, overall sadness, and sleeplessness. Postpartum anxiety is another thing newborns deal with. Due to the rise in hormones and oxytocin, brain areas related to empathy and anxiety are heightened. This can lead the mother to fend for her baby, causing high levels of stress. And then, thank you. This is the end of our presentation.